I would like to introduce to you our president, Dr. Valerie Montgomery Rice, who will share her strategic vision and introduce our keynote speaker for today. But just a few words about Dr. Rice. Dr. Rice is a medical doctor who is renowned infertility specialist and researcher. She previously held the positions of Dean and Executive Vice President of Morehouse School of Medicine, where she has served since 2011. Dr. Rice came into the presidency with experience at the highest levels of patient care, medical research, organizational management, and public health policy. She is a transformational, strategically focused leader with a track record of redesigning complex business infrastructures to reflect the needs of evolving strategic environments and implementing sustainable tactics to position those organizations for success. And now, the sixth president of Morehouse School of Medicine and the first woman to lead a freestanding medical institution in the United States, I welcome our president and CEO, Dr. Valerie Montgomery Rice. Dr. Rice.
Thank you, Dr. Mack, and good morning, everyone. Welcome to Morehouse School of Medicine virtually. Hopefully we will get to see you in person sometime soon in the near future. Let me begin by congratulating the team. I know how important this work is to what we do at Morehouse School of Medicine as we lead the creation and advancement of health equity, and I applaud the team for not stopping, even though we only can hold this right now virtually. We expect to be back in person soon. The purpose of having these type of symposium, you all, is really to look for what I see written several times in the opening remarks, these windows of opportunity. Unfortunately, we have been forced, plagued, some say, with this co-occurring crisis of COVID-19 pandemic and racism, both structural and interpersonal. And what it has done, guys, it has galvanized the nation. And because people are paying attention, we believe, like many of you who are participating today, that we have an opportunity at Morehouse School of Medicine. We have an opportunity with our partners. We have an opportunity in this country to actually seize upon the attention that people are paying, to make sure that we are unified in our focus on health equity. This summit has convened leaders in medicine and public health and research and policy and advocacy and business to discuss how we can leverage primary care, innovation, and leadership to advance health equity. These were the principles back in 1997 when the center was founded under Dr. Lewis Sullivan, the former Secretary of the U.S. Department of Health and Human Services and the President Emeritus of Morehouse School of Medicine. For 25 years, this center has been doing this work, trying to push it out of the background into the forefront of discussions that will occur at table discussions, whether it was in the White House table, or whether it was a table in Congress, or whether it was at the kitchen table. This co-crisis, these co-concurrent crises of racial discrimination and COVID-19 pandemic has allowed these conversations to occur among diverse stakeholders. So we are very excited about you being here today. We're excited about hearing from Dr. Satcher and Dr. Sullivan and Dana Bowman, Dr. Dana Bowman Matthews, I should say, who's the Dean at George Washington University School of Law. The keynote addresses that you're going to hear today and tomorrow by Dr. Brian Smedley. You're going to hear from the mayor of the city of East Point, one of our co-partners in co-creating health equity for the community. and others who are representing several federal arms that make a difference in health equity. We're excited that you have chosen to take the time for the next 2 days to learn and to add value on how we can lead the creation and advancement of health equity.